today's topic. It's ischemia and infarction. Okay. So it is inadequate blood supply to a part of the body. Okay. So effect of ischemia will be there on the organs or tissues who does a lot of work in our body, like the vital organs. What are they? Brain and hearts. Because as they does a lot of work, they will need more oxygen. Their demands of metabolic demands will be more. Okay. So there are causes of ischemia. These are like generalized cause, which are like it could be affected in all over the body, like hypovolemic shock, cardiac failure. In case of cardiac failure, okay. Hypovolemic shock is what? It is a state or condition of our body when our body loses fluid or blood. Like in dehydration state or in accidents, there will be bleeding. In such cases, localized causes includes atherosclerosis. Now, can anyone tell me what is atherosclerosis? Yes. Yeah, it is basically narrowing of the arteries due to deposition of fats. So, as a result, what will happen? There will be restriction of blood flow. Okay. So, this may lead to various serious events like stroke, heart attack, etc. Thrombosis and embolism I will discuss later on. And vasculitis, can anyone tell me what is vasculitis? Yes. As it is written here, itis, that is inflammation. It is inflammation of the vessels. Okay. And spasm of the vessels, that is the vessels become constricted, constriction of the vessels. Next is localized causes, involves 3 levels of occlusion. That is 3 levels of blockage are there. What are those? Arterial blockage, venous blockage and microcirculation occlusion. So in arterial occlusion, we can find in condition, examples are thrombosis, embolism, vasospasm, arteriosclerosis, torsion and ligation of the vessels. Means twisting of the vessels, and ligation like in surgeries when there is any bleeding from the arteries, surgeon ligate that part, okay. And tourniquet, we already covered what is tourniquet. When it is tied too tightly, that could be the reason. Venous, like again thrombosis, varicose veins, I will talk about it later on, and hematoma, okay. And microcirculation occlusion, it's mainly block the capillaries. Okay. So examples are sickle cell anemia, fat embolism, vasculitis, bed sores. Bed sores are mainly found in bedridden patient, prolonged bedridden patient. Okay. And sickle cell anemia, in case of sickle cell anemia, the RBC becomes sickle shape. So few RBCs get stuck together inside the capillaries, leading to blockage of the capillary flow. Okay. Next topic is infarction. So infarction, what is infarction? It is necrosis due to ischemia. It is basically necrosis which is caused by ischemia. Okay. So, the formation of localized area of ischemic necrosis within tissue or organ due to decreased blood supply. It is also termed as hypoperfusion. What are the causes? You can remember it better with the help of this mnemonic, T vector. Okay? T and E stands for thrombi or emboli. V stands for vasospasm. As I told, it is vasoconstriction. Expansion of the atheroma, extrinsic compression of a vessels, vessel twisting and traumatic vessel rupture. Okay. This one is thrombi and emboli. See, thrombi is basically a blood clot in the vascular system. But emboli is what? When the clot travels throughout the bloodstream, then they block the arterial or venous supply. Okay. Then local vasospasm. It is nothing again constriction of the vessels which leads to ischemia and death. Ultimately necrosis of the tissue occur. You are seeing the picture here, narrowing of the vessels. So RBC in one side it is more, in one side there is decreased flow of RBC. This is expansion of the atheroma. It is mainly accumulation of material in the inner layer of the wall of an artery. You are seeing fatty depositions here. Then comes, you have heard about stroke, na? The stroke may be of two types basically. One, see, compression of the vessels may be there. One, just only clot formation may be there. That one, ischemic. In another case, हम कभी-कभी बोलते हैं कि stroke हुआ है, bleeding हो रहा है. So that is nothing but rupture of that artery or rupture of the vessels. Due to rupture of the vessels, bleeding is occurring. So it is termed as hemorrhagic stroke. When there will be rupture, there will be blood will come out. That is known as hemorrhagic stroke. This one is vessel twisting. Vessel twisting, this condition is known as, very good. It is due to dilatation of the veins of the lower limbs. What happened mainly, here there is backward pulling of the blood. Instead of going blood into the heart, efficiently flow, blood flow towards the heart is hampered. Okay, there will be backward pulling. That's why there is dilatation of the veins. Now, types of infarction. What are the types of infarction? Red infarction, which may be hemorrhagic, white infarction, anemic, and septic infarct. Okay. So, red infarction, can anyone tell me why it is termed as hemorrhagic? If I take example, I discussed with you about hemorrhagic stroke. So, there will be rupture of blood. When there will be more blood, more RBCs will be there. It will appear reddish. So, red is termed as hemorrhagic. And in case of white infarct, if we take example of anemic patient, in anemia what happens? There is reduction in hemoglobin level, blood is less, so it looks more pale, more whitish kind of compared to that red. Okay, that's why termed as white or anemic. Next is septic infarct. Septic infarct is due to infections. Very good. It is mainly due to bacteria causing infections. We can also find pus formation there, abscess formation can be there. Okay. So see, these pictures are showing red or hemorrhagic infarcts. This is picture of ovarian torsion. Here kind of bluish appearance is there. Bluish appearance is mainly due to venous occlusion. Okay. And this is infarction of lung. Next, again another hemorrhagic infarct is small intestine infarction. दिख रहा है ना intestine? Another one, this is renal infarction. Okay, this one is the infarcted part. This seems more whitish than the normal areas, no? Okay. So apart from renal kidney, we can find infarction with this white infarction in what other organs? Yes, heart and spleen. Okay. See, this is septic infarct. This is pus formation may be there, as I have said, bacteria containing emboli present here. This is due to infections. Next, there are some factors that influence development of an infarct. These are nature of vascular supply, rate of development of occlusion, vulnerability to hypoxia, and oxygen content of the blood. Okay, so what are the four factors? Tell me, read out. First, we will discuss about the nature of vascular supply. See, there may be in some organs, there may be double or single blood supply also. So, the availability of an alternative blood supply is the most important factor in determining whether occlusion of a vessels will cause damage or not. For example, lungs. Lungs is having dual blood supply. One is pulmonary and other is bronchial. So suppose what happened? If pulmonary one is affected, bronchial can manage it for some time. This is the thing. Okay. Next is rate of development of occlusion. Like slowly developing occlusions are less likely to cause infarction because they provide time for development of alternative pathways. For example, 3 major coronary arteries are there. If one is affected, the other 2 can again manage it at least for a few times. This is the thing. Okay. Vulnerability to hypoxia. So we have different kinds of system in our body. What are the systems? Yeah. Cardiovascular system, respiratory system, gastrointestinal system, musculoskeletal system. These are all the systems. Okay. So different kinds of systems are having different kinds of cells. So in our body, neurons, they undergo irreversible damage when they are deprived of blood supply for 3 to 4 minutes. But in heart, we have different kinds of cells. One of the kind is myocardial cells. These myocardial cells may die after 20 to 30 minutes of ischemia. Okay. Next, in myocardium only, there is another kind of cell known as fibroblast. Okay. Now, this fibroblast may remain viable even after many hours of ischemia. This is the difference. Okay. Oxygen content of the blood. The partial pressure of oxygen in blood also determines the outcome of vascular occlusion. Partial flow obstruction of a vessel in an anemic or cyanotic patient might lead to tissue infarction, whereas it would be without effect under conditions of normal oxygen tension. You won't understand anything from this slide, I know. The thing is that in anemic or cyanotic patient, in such compromised patient, the oxygen flow towards the vitals organ is less. So, in those patients, the chances of infection is more. So, different organs in which we can find infarcts. What are those? Myocardial infarction we can find in where? Heart. So, this is a type of pale infarct, frequently lethal. Pulmonary infarction in lungs is hemorrhagic, which is less fatal. Okay. And cerebral infarction can be both hemorrhagic or white or pale. Okay. It is, if occurs massively, it could be fatal also. Other organs like kidney, intestine, spleen, liver, lower extremities, we can also find infarct. See, myocardial infarction is a very common thing. Okay. So, it mainly occurs why? Due to blockage of coronary arteries. It may occur at any age, but most common ones are elderly. Elderly people are most commonly affected. Okay? And they may die within first few hours of onset. Suddenly they may die. You were saying here, due to coronary artery blockage, the blood flow towards the heart, inside the heart is also hampered, and oxygen supplied inside the heart is also hampered. Okay. Pulmonary infarction. Pulmonary infarction is due to thromboembolism mainly. So, this is a radiological picture which is showing the infarction which is present on the base of the pleura. What is pleura? Can anybody tell me? Covering of the lungs, outer covering of the lungs. It may be hemorrhagic and it is mainly found in the lower lobes. Cerebral infarction, which is mainly due to compression of the cerebral arteries. Cause again due to arterial and venous occlusion. So, as I say, it can be both anemic and hemorrhagic. Affected areas are mainly junction between the grey and white matter. See, this is CT scan. This is a CT scan picture. The darker area is showing the infarct. Okay, this is the same thing. The darker area showing the infarct, cerebral artery is affected, and this is the vessel. Blockage might be due to fatty deposits, cholesterol deposits, or maybe due to thrombus. Okay, so that's all. You can now go to your practical rooms.
One, what type of injury has the infarct caused? 2. Describe the histopathological features. 3. Draw a neat level diagram.
So, can you tell me what type of injury has the infarct caused? एक बार स्लाइड देखो फिर बोलो. What is the slide?
They have the dilated
Can you name the slide? Kidney slide will never be an answer.
acute tubular necrosis.
Very good. This is basically a repetition class. Okay, but here topic is different. So this is basically a slide of acute tubular necrosis. So what type of injury has the infarct caused? Here irreversible cell injury. Okay, so what is the type of necrosis? Yes, and what kind of infarct is this? What kind of infarct is this?
White infarct.
Very good. White is white.
Anemic.
मतलब एनेमिक और वाइट क्यों हम बोलते हैं इसे?
Hemorrhage.
Like you remember it like this, in as it is termed as white or anemic infarct. In anemia, what happens? The patient is having decreased level of hemoglobin, so there will be decrease in the RBCs. So basically हम क्या देखते हैं? पेल हम कहाँ पे? Anemic patient पेल होता है ना, तो remember it like this. And red infarct or hemorrhagic infarct, white is termed as red.
Blood rupture of the blood vessels, we can see lots of RBCs.
Yes, very good. That's why. Okay, like in rupture of the blood vessels, more amount of blood, more RBCs. That's why. Okay, so another type of infarction is there. What is that? Apart from so it is basically due to
Bacterial.
it is caused by infections. We can see pus formation, abscess formation there. Okay, so what is the difference between thrombi and emboli?
And thrombi is the blood clot, and emboli is the thrombus that travels in the blood
Throughout the bloodstream. Okay, very good. You have to remember this one. It's very important. Okay, so number 2, you can write the first answer. What type of injury has the infarct caused? Irreversible type of cell injury. It can be coagulative necrosis, and this is a kind of white or anemic type of infarct. Okay, now necrosis mean you can mention because examiner sometimes may ask you. Okay, now describe the histological features. Now somebody come see and tell me the histological features as it is a repetition class.
Ectodilated glomerulus and
Glomerulus will be there.
The
Distorted tubules or the affected tubules. Okay, and
Uniform appearance has been disturbed.
These are the normal tubules. The uniform appearance that are giving, these are the normal tubules, and the affected tubules are having no definite shape and size. There, some of them are flattened, some of them are dilated. You can see tubular, some of them are there. And another thing about the cytoplasm,
More eosinophil.
yeah, very good. Why? Why it is pinkish here more?
proteins are destroyed. RNA is also destroyed.
You answered it. Why? Already तुमने answer किया. Why the cytoplasm is more pinkish? Because there is increased amount of eosinophil on the affected side. Okay, and the outlines of the cells are maintained, but the nuclear and cytoplasmic details are lost, giving it a which kind of appearance?
Tombstone.
It is very much important. Okay, associated question may come. So, what are the other types of necrosis apart from coagulative necrosis?
Caseous, fat, fibrinoid,
Hmm.
Gangrene.
Then
Liquefactive.
carious necrosis is there. Okay, so apart from this is a infarction on. This is a infarction on what?
Kidney.
Very good. So apart from kidney, what are the other organs in which?
heart and spleen,
Heart and spleen. Very good. Okay. And what are the organs you can find that red kind of infarct?
brain,
Intestines. Ovary.
ओवरी में क्या पिक्चर दिखाया था मैंने?
Bluish. Venous.
White is blue.
Usually venous.
When there will be venous occlusion, it will seems to be more bluish. Okay. So it is ovarian torsion. Other organs?
Lungs.
Another? Okay, I have seen another one. Intestine.
intestine,
Okay. Now, picture याद है ना intestine वाला? So, basically you have to remember the pictures. So, you can recollect it better. Okay. Next, what is varicose veins? जो मैंने बताया था white occur varicose
Due to
vein.
the dysfunction of the valves of the vein, there is backflow
upward
of
pulling
blood.
of the
Not upward, backward
Backward.
flow. Backward pulling of the blood. Blood is not efficiently flowing towards the heart. It is rather coming backward. So due to that pulling of the heart, pulling of the blood, the veins become more tortuous, dilated. Okay. So we can find this in commonly in home. In traffic polices, okay. Examiner may ask you in traffic polices, these are most commonly seen. Or long standing, those people who are doing long standing duties, okay. So these are the questions examiner may ask you. So this is a slide which is a plus point for you. Histological features will be same, but to both ways question can be asked. One is from necrosis, another is from
Infarction.
infarction. So what is infarction?
There is tissue death caused by ischemia.
Necrosis due to ischemia. Okay. Then what is ischemia?
decreased blood supply,
Inadequate blood supply. Okay. So what are the causes of ischemia?
hypoxia,
No. It is classified into. I told you. Generalized causes and localized causes. Okay. In generalized,
Hypovolemic shock.
what is the condition? This shock. Everybody tells you shock, but what is that shock? It is a condition when our body loses a huge amount of blood or fluid, like in dehydration, there is electrolyte and fluid imbalance, or in accidents, there may be huge amount of bleeding. So, in that state, the patient may go into shock. Okay, this is another local causes. What are the localized causes?
atherosclerosis,
What is atherosclerosis?
formation of
Deposition of atherosclerotic plaque in the blood vessel and in the venous.
Deposition of due to like fatty deposits, cholesterol, etc. Okay. Okay. Now, what are the other causes apart from atherosclerosis?
hemorrhage,
This comes under shock only. So there may be thrombus formation, embolus formation,
Vasospasm.
vasospasm. Very good. There may be vasculitis. That is infection of the vessels. Okay. So what are this localized causes involves 3 levels of occlusion or blockage, you may say. What are those 3 levels of blockage?
Arterial, venous, and microcirculation.
Microcirculation is what?
Yes, capillaries.
Yes. वो छोटा छोटा रहता है capillary. So it is termed as microcirculation. Like in sickle cell anemia, fat embolism, bed sores, etc. ठीक है? So everybody can answer.